Hello, my name is Angela Solis, and I'm owner and therapist at Crossroads Counseling Services. We have offices located in Plainfield, Ottawa, and Morris, Illinois. We have a variety of clinicians available with diverse clinical backgrounds and areas of expertise. With me today is one of our nurse practitioners, Victoria Brugert, also known as Tori. Tori, tell us a little bit about yourself.
Hello. My name is Tori, and I'm a nurse practitioner here, like Angie said, with Crossroads. And I grew up in Shorewood, Illinois. Currently reside in Diamond with my two boys, Camden and Austin. I plan on specializing in postpartum mood and anxiety disorders, which basically breaks down to PMADS. So we will talk a little bit about that later on.
Yeah, let's actually go right into that. So when you say what's your area of expertise? I mean, I think, well, maybe overall, like what do you currently treat? Like what's your age ranges? I mean, you do a lot of mood disorders. Do you have a particular, because I know you have a lot of that postpartum and that background. Can you tell us a little bit about just your practice itself and like kind of where you find more of that specialization?
Perfect. So I do a little bit of everything, primarily anxiety, generalized anxiety, depression, as we talked about, perinatal mood and anxiety.
And anxiety disorders, yes.
Yes. PMADS for short, which basically talks about these mental health issues in pregnancy and postpartum. I myself suffered with my first and did not realize it till way too late and found my calling there. So got help with my second. Like I said, I have two boys. I'm in the midst of everything with you mamas if you guys are watching. And along with that, I think other things that I focus on are ADHD and other mood disorders such as bipolar or borderline personality disorders.
Which is excellent. And I know you have a lot of that where you deal with a lot of women's issues and a lot of, obviously, with us moms, there's many issues that kind of naturally come with that post-pregnancy and in the midst of child rearing and whatnot, so that's excellent. Exactly. But also with that, I know you treat some men, so we don't want to leave the men out. There's what you see with just a variety of different anxiety, depression, and various mood disorders as well, correct?
Yes.
Awesome.
You're right.
So tell us, what do you find most enjoyable about your practice?
Two things that pop into mind when this question is asked is my patients, because you guys drive what I do. I'm here to serve you in any way, shape, or form that you need to. So I connect you guys to therapists, connect you with medications. Sometimes I don't even say that medications are needed. Secondly, I think that the people I work with has a pretty huge impact on what I do. If I didn't like my job, I probably wouldn't stay here this long. So the fact that the company is very supportive of me as a provider, as me as a mom, as my family life, that's been huge to me and a great success.
Awesome, and I love hearing that too. And I think that's really important that people know that when they walk through these doors, it's not just necessarily a one-stop shopping with this individual, but really looking at what are all those needs and looking at that person as a whole and being able to access some of those other resources, even if it's outside of Crossroads. I think that's really important for people to know that if it's not just a med issue, that may do a lot of solving a lot of issues, but there's much more that might be entailed to that. So that's excellent. And again, maybe with that too, can you speak to a little bit to what you would say to somebody that might be apprehensive about starting a med or starting this process? What would be your words of wisdom there?
Yes, so it is scary. Walking in these doors, it's a huge step. There's a big stigma with mental health, unfortunately. One of my goals is to make mental health as common, or going to therapy or coming to see me, as common as going to the gym. You work out physically, right? We have to work your brain out. We have to get those things out on the table. So for you to take that huge step to come into here is amazing, and I applaud everybody that does walk through our doors. But just, it's new. It's something that, let's say you're driving for the first time. You're scared, right? But you still do it. We get through it. Like I said, going to therapy, it's nerve-wracking. Coming to us and spilling your guts, saying, these are all my problems. Like, let's focus on the negative in my life. But we try to make that a positive impact on you and turn it around. So just kind of come with an open mind. We're open-minded people. That's why we're in the job. So you're not going to make us scared or freak us out or in any way by what you say. Yeah, this is no judgment zone. These walls have heard everything that you can even imagine. So don't feel like you're going to shock us when you come in the doors, and just come with open mind on the experience, and let's see what we can do for you.
Excellent. And what is there anything maybe specifically you can speak to as far as some of the benefits that you've seen with specifically with med management, like maybe and probably other things that maybe you've come across with in this field and in your practice?
Yes, so some benefits that we talked about that I probably think is mainly self-realization. So my biggest goal is that I'm a big pusher for therapy. I think that that is your long-term success. Medication is here to help you get there. Everybody doesn't need medication forever, so that doesn't mean when you walk my doors, this is what you're getting and this is what you're on and that's your final destination. We're always revamping, we're always changing. So down the road, like I said, I think the biggest thing is self-realization, mindfulness, and coming out with those tools. And medication is another tool that we use to help you get there. The more work that you do on your end, the better results that you're going to get. So that means utilizing those tools that you use in therapy with Angie or in therapy with any of our other therapists, and really taking what we say home and to heart. You don't go to the gym and just sit there and then come home and you're like, okay, I'm gonna eat like crap. Some people do. But you know, you have to it's a two-ended story, so make sure that you're utilizing the tools, like I said, that both of us are giving down the road. And
very good. Great. Well, thank you so much, Tori, for sharing a bit more about your practice and your therapeutic style. If you would like to make an appointment with Tori, please contact us at 815-941-3882, or feel free to visit our website at crossroads-helps.com.